Okay, so before we start labeling everything on a picture, what we want to do is maybe start to create a chart for ourselves, which is going to be our general scheme for our heart that we can also use for blood flow later. So here I just have, like a Valentine's Day heart, basically. And what we're going to remember is there's got to be four chambers, there's got to be four valves, and there have to be four blood vessels. In order for this to occur, I have to split my heart into four areas. Okay, so I'm going to split my heart right down the middle like that. And then I'm going to come over here and I'm going to split it into a superior portion and an inferior portion. And I'm just going to give myself some room because I have to have blood flowing from the top part of the heart into the bottom part of the heart. Okay. So that means I have four chambers. Perfect. My four chambers are going to be my right atrium, my left atrium, my right ventricle, and my left ventricle. So over here, I'm just going to write right atrium. My pen will work. And over here, I'm going to write left atrium. I should know not to write sideways. Writing sideways is so difficult. Okay. So those are my arriving chambers. This is where blood is going to flow into the heart. And then blood's going to flow into these inferior chambers. So I have a right ventricle and I have a left ventricle. And I need to actually write my word in a slightly off a little bit because I need some stuff at the bottom there. I forgot. Okay, perfect. We got our four chambers. Now we need our four blood vessels. Okay. So on the right side, we're going to always have blue blood vessels. One blood vessel is attached to the atrium, or one set of blood vessels are attached to the atrium, and one set of blood vessels are attached to the ventricle. I hope you understand this is not an anatomically correct heart. That's why it's a chart. Okay. Blood vessels attach at the atrium and they attach at the ventricle, but all those blood vessels actually are at the base, which is at the top of the heart. Okay. The apex, which is the pointy part of the heart, is the bottom of the heart, and nothing actually comes out of the apex. This is just going to help us later for blood flow. All right. And then on the left side, again, I have to have a red set of blood vessels, one attaching at my atrium and one attaching at my ventricle. Okay. So the blood vessels that attach at the atrium are always veins. Veins bring blood into the heart, whereas the blood vessels that attach at the ventricles are arteries, and they always take blood away from the heart. Okay. And we'll label all these things. I'm just setting up my chart, basically. Then I have to remember four valves. So there's a set of valves that go between the atrium and the ventricle on both sides. These are called atrioventricular valves, and they have specific names on the right side and specific name on the left side. And then the other place where I'm going to have a valve here, I'm just going to use my white to kind of like white out that area right there and right here. You don't have to do this. I'm just doing this so that I can use this later for blood flow, and there's nothing inhibiting my blood flow. I should have thought about that before getting started. But you know how stuff goes. See, then I can't find my pen. There we go. Oh. And I kind of have to do that because my next set of valves have to go between the ventricle and the arteries. So I'm going to have these half moon shaped valves that are at the entryway of the arteries. These are called semilunar valves, right? Like that. They kind of look like that because remember, it's a half moon shape and there's three of these like cups in a half moon shape. So that kind of looks like I don't know, like an owl face a little bit. So it's a nice like setup for our heart. Okay, we have 4 chambers, we have 4 blood vessels, we have 4 valves. So hold on to that. We're going to come back to that as soon as we start looking at the other anatomical components. Okay, so I'm going to do this by labeling some of my pictures from the PowerPoint, or basically artistic renderings of pictures, and talk about the anatomy so you guys can do this yourselves as well. So one of the things you have to realize is that is really easy to figure out, but this is a little bit different. You're going to have to figure out what is anterior, what is posterior, what is left, and what is right, okay? Especially on a lab practical exam where you're just going to have a heart that's not inside the body anymore, and you're going to have to figure all those things out. So one of the things that are going to help you is remember atria are at the top and ventricles are at the bottom, but also this broad area here. So this broad area at the top, this is the base. Okay. And at the bottom here, this is the apex. The apex always points towards the left hip and is actually always associated with the left ventricle. So if you come back to your picture here, you might want to kind of like make sure that your apex is part of your left ventricle, just to help you out a little bit right there. So if that's my apex, that means this whole area is my left ventricle. And I'm just going to abbreviate. You are not allowed to abbreviate on tests. You have to write the whole thing out. And then that means that if I just jump over here between, this is the anterior interventricular sulcus right here that holds these coronary blood vessels. And it's going to separate the left ventricle from the right ventricle, which is right there. And that's going to help me figure out where my left ventricle is to help me figure out where my right ventricle is. And then once I figure out where this area is my right ventricle, then I can come upward here, and this is my right atrium. And then I can jump over that way, and this is my left atrium. Or I can jump up here, and I can figure out that's my left atrium, okay? So the apex always helps you, even on the posterior side. So this is actually anterior. And this over here is posterior. Okay, so again, there's the apex, and we're going to see this is the posterior interventricular sulcus where we have these coronary arteries here. That tells me this is left ventricle. So up above that, that is left atrium. And then over next to it is right atrium. And then underneath that is, whoops, right ventricle, basically. Okay, so once you figure out the ventricles, then the next thing would be is like, what are the arteries and the veins attached in these different places? Okay, and so you kind of notice how the base is where all the blood vessels are attached to. They're not coming out of the apex, even though that's what I have on my chart right here. So how did I know this was anterior, and how did I know the other one's posterior? What you're going to look for is on the front side, there's a big artery that comes out that's attached to the right ventricle. This is pulmonary trunk. So pulmonary trunk is really only seen from the anterior side, and it will always directly connect to the right ventricle. And then the one back behind it, this is the aorta. The aorta actually attaches to the left ventricle, but it's more posterior to the pulmonary trunk. So sometimes that's not the greatest reference for the front side of the heart because it's not always visible, but pulmonary trunk is always visible in the front. The back side of the heart is going to have all of these veins, basically stuff that's dumping blood into the heart. And normally it's kind of like a mess in the back. So it's hard to kind of figure out what's going on in the back. Usually you can tell that's the back, or look for the front. It's a little bit easier. Okay, so that's pulmonary trunk, that's aorta. What we're going to see is coming off of the right atrium at the top here, this is a vein called superior vena cava. And then there is a vein here that looks like it's like in the back, and maybe you don't know where it's going, but it's actually attaching to the right atrium. This is inferior vena cava. Okay, so when we go to the back side of the heart, let me move my picture here. What you're going to see is that this blue vein right here, so right there, that's again superior vena cava, and then this blue vein in the back attached to the right atrium is inferior vena cava. Okay, so those are the veins that are attached to the right atrium. The left atrium is also going to have veins that are attached to it. It's actually these red veins right here. And I know you're thinking, wait, isn't veins supposed to be blue? And then our arteries are supposed to be red. Remember, that doesn't apply at the heart. Red and blue just means carbon dioxide rich blood is flowing through it versus oxygen rich blood is flowing through it. So here you have to know directionality of blood flow to help you remember whether or not it's an artery or a vein. In this case, these are the pulmonary veins. Okay, so this is the left pulmonary vein, anatomical position. These are left pulmonary veins, and over here I have right pulmonary veins. Like that, okay? And I'm just gonna come up and I'm just gonna erase this base part, mostly because it's just getting in my way in terms of my labeling. So you can see those are actually mostly on the posterior side, like that. So actually, that's my left pulmonary veins, and that's my right pulmonary veins. If you don't know your right from your left side, just think about, well, those ones are closer to the right atrium, so that's the reason why. So that's our anterior versus our posterior side. Here's still the aorta. It's just coming and looping in the back. And then if you're wondering, what are these blue things? Well, here we see pulmonary trunk, and pulmonary trunk, this becomes the left pulmonary artery. I'm just going to abbreviate with an A there. And again, that over there is right pulmonary artery. It's like, well, it's blue. How come it's not a vein? Because blood's going to flow, remember, out of the ventricle towards the body. And when it does, it's flowing away from the heart. So that gives me an artery. So again, these two here are the left pulmonary arteries. And then those two are the right pulmonary arteries. Okay, it'll make a lot more sense when we go through blood flow. But that's the anterior portion of the heart and the posterior portion of the heart if you just label the basic stuff. Okay, so what that means is you can come back to your scheme here and you can start to label, well, at least I know what this is. This is superior vena cava and inferior vena cava, right? Because it's attached to the right atrium. And this has to be pulmonary trunk. Because pulmonary trunk is attached to the right ventricle. And then over on the left atrium, this has to be my pulmonary veins, because those are attached to my left atrium. And this has to be my aorta, because my aorta is attached to my left ventricle, okay? So we're starting to build this heart chart. It's going to basically be pretty much the thing that you can study for the test, and it'll probably help you with blood flow, where everything is located, just kind of build more and more on this chart. Hopefully it doesn't get too gnarly. So the next part we're going to look at, when we cut open the heart and we look internally, what are the other structures that the four chambers are going to have, including what are all these valves?